Millions of people are dying each year from preventable and treatable diseases like malaria, TB, and HIV/AIDS. This is Ramadani. Ramadani was only a few months old when he woke up with a fever from malaria. With limited access to a free clinic in central Tanzania, Ramadani was given chloroquine. Little did he know, chloroquine was an antiquated anti-malarial drug which African parasites had grown resistant to and was ineffective. There are still 3.4 billion people spanning 106 different countries, just like Ramadani, who don't have access to effective drugs. But why is this the case? After all, pharmaceutical companies do have the resources to produce research and life-saving drugs. But until now, they have been remiss about making a greater difference in global health because their only incentive was profit. But what if, by using indices or public ranking systems, we can provide a new kind of incentive? What if these indices can substitute for something that money simply can't buy, a better company image? This is exactly what we are trying to do at the Global Health Impact Project. So how can we do this? We start by creating an evaluation system which gives consideration to drug need, access, and efficacy by looking at the DALYs, or the Disability-Adjusted Life Years Averted. This means that we start by looking at the need for particular drugs, strictly from diseases like malaria, TB, and HIV/AIDS, so we're not looking at death due to other causes like natural death, accident, etc. Then we take this data and put it into a mathematical model which multiplies the portion with need by the portion with access and the portion of efficacy to produce an impact score, or the DALY saved. This number reflects the number of people that are saved because they have access to effective drugs. From there, we can take the DALY saved to create drug scores by aggregating them across all different countries. For example, AL is one of the most commonly used anti-malarial drugs globally. We take the amount of DALY saved across all different countries by AL and add them up to create the AL drug score. This creates the basis for the first of our 4 major indices, the drug index. As you can see, the drugs with the most DALY saved rank higher than the drugs with the least DALY saved. This creates a depiction as to which drugs are saving the most lives. These drug scores can also be aggregated by individual pharmaceutical company, country, and disease to create our other 3 indices. Let's turn to the potential benefits of a ranking system like ours. First, these indices will create an accurate depiction as to the current state of global health. Second, it will provide incentives for pharmaceutical companies to make a greater difference on global health. And third, it will allow governments and non-governmental agencies to set attainable and appropriate goals for the future of global health. So what can you do to make a difference in global health? Well, you can start by checking out our website in the link below, or following us on social media such as Facebook, Instagram, and Twitter to get the latest updates on our project. Together, we can work towards a world with less pain, less suffering, and less death.